I've been talking about a breastfeeding challenge in my last two videos. I would like to discuss these challenges in 15 videos. So this is my third video on breastfeeding challenge. Today I will be talking about when your breast is producing too much milk after delivery. This is a problem. Just like in my second video, I talk about when your breast is not bringing out milk or the milk is not enough. This video, the third one, I'm going to be talking about the third breastfeeding challenge, which is when you are producing too much milk. This is common in the first 6 weeks of delivery. Some women have a good production of breast milk. So what is the problem with too much breast milk? The first one is that if your breast milk is too much, it can choke your baby. It can be too much. As the baby is rushing it, it can choke the baby. That's the problem with it. And number two, the rate at which your baby empties it may not be enough. Then you have so much collection of breast milk, which may give you pain, engorgement. So what is the solution? What is the solution to these two problems? What are the solutions to them? Number one, in order to avoid your baby being choked with too much production of breast milk, the first thing is learn to breastfeed your baby on demand. What I meant by demand is let your baby breastfeed as he or she cries. Don't time your baby. Don't say every 3 hours or every 4 hours. If you do that and you have production of too much milk already, then you may likely have engorgement and you may likely choke your baby by the time you want to breastfeed every 4 hours according to timing. So let it be on demand. Usually most babies demand for breast milk every 2 hours. So what you do is breastfeed your baby on demand, so it helps you to empty your breast frequently. And number two, breastfeed your baby from the two breasts at least 10 to 20 minutes on each. Let them suck the breast very well so that they can empty the ones you have produced. Then number three, gravity pushes breast milk down more. Gravity. When you sit down, of course, sitting down is the best position to breastfeed. But in this situation, we have a problem in our hand, which is too much breast milk. So in this situation, I will advise that you avoid gravity. And how you can do that is you can lie down. But I must warn you, when you lie down to breastfeed your baby, there is another problem that can occur. The baby can choke, which is the problem we are trying to solve, so that we don't solve one problem and cause another. So that means you have to be careful. As you are lying down, make sure your baby's head is a little bit raised. You can use your hand to do that. And then you suckle the baby, you put the breast in the mouth of the baby, so that the rate at which the breast is flowing is slowed down, because gravity is not pushing it down when you are in a lying down position. So as you do this, it helps to slow down the rate at which the too much milk is coming. Then number 4 is that you need to use your hand to control it. Around the black area around your breast, you can put your hand in such a way that you can control the rate at which the milk is coming out, so that you put it in the mouth of your baby and then it's coming out at the rate at which you can control it with your two hands. With your 2 fingers, you hold the breast and then you can squeeze it a little to control the rate at which the milk is coming to the mouth of your baby. Then after doing all this, if you are still producing much milk, try and empty out of it. You can use your breast pump and empty out of it and keep for your baby. Don't empty too much, because when you empty too much again, it's a problem. Your brain senses it as, okay, maybe it's your baby that empty everything, then it produces more. So that we don't try to solve one problem and now like create another one or create a cycle of the problem. So you just take small out of the 2 and then continue the first 4 that I've mentioned: the frequency, the duration, You can lie down and then you can use your hand to control the breast milk. Visit my page on Instagram. I'm Dr. Health Education. We still have 12 more challenges of breastfeeding to go, so stay tuned to my page. I will educate you on number 4th challenge very soon. Thank you.